Imagine waking up one day and realizing your body has been trying to warn you for months, maybe even years, but you didn't recognize the signs. What if some of the everyday symptoms you've been ignoring are actually your kidneys quietly asking for help? Today, we're talking about 18 visible signs of kidney disease you should never ignore, because catching these early could literally change or save your life. Stay with me, because some of these signs might surprise you, and one or two may already be happening to you right now. Your kidneys are small, but they do a massive job. They filter waste, balance fluids, regulate blood pressure, and keep your blood healthy. The problem is, kidney disease often develops silently. Many people don't feel sick until serious damage has already occurred. That's why visible signs matter so much. One of the earliest signs many people notice is changes in urination. You might be going more often, especially at night, or much less than usual. Your urine may appear foamy, bubbly, unusually dark, or even bloody. Some people feel pain or burning when urinating, while others notice a strong or unusual odor. These changes are your kidneys struggling to filter waste properly. Swelling is another major red flag. When kidneys aren't working well, excess fluid builds up in the body. This often shows up as puffiness around the eyes, swollen ankles, feet, hands, or even the face. If your shoes suddenly feel tighter or your rings don't fit like they used to, it's worth paying attention. Persistent fatigue is a sign many people brush off as stress or lack of sleep. But unhealthy kidneys can lead to a buildup of toxins in the blood, making you feel constantly tired, weak, or mentally foggy. You might notice difficulty concentrating or feeling drained even after resting. Your skin can also reveal kidney trouble. Dry, itchy skin may be a sign that your kidneys are no longer maintaining the right balance of minerals and nutrients. In more advanced cases, skin can appear pale or yellowish due to anemia, which often develops with kidney disease. Another visible clue is sudden or unexplained weight changes. Fluid retention can cause rapid weight gain, while loss of appetite and nausea may lead to weight loss. Many people with kidney issues experience frequent nausea, vomiting, or a metallic taste in the mouth that makes food unappealing. Shortness of breath is another symptom people don't always connect to kidney health. Extra fluid can build up in the lungs, or anemia can reduce oxygen delivery in the body, making even simple activities feel exhausting. High blood pressure is both a cause and a consequence of kidney disease. If your blood pressure has been creeping up despite lifestyle changes or medication, your kidneys may be involved. Over time, uncontrolled blood pressure can further damage them, creating a dangerous cycle. Muscle cramps, especially in the legs, can be another warning sign. Imbalances in electrolytes like calcium and phosphorus happen when kidneys aren't filtering properly, leading to painful cramps or twitching. You might also notice bad breath or a persistent ammonia-like smell. This happens when waste products build up in the blood, a condition known as uremia. Along with that, mouth sores or a constant dry mouth can appear. Trouble sleeping is another overlooked sign. Toxins that should be filtered out by the kidneys remain in the bloodstream, disrupting normal sleep patterns. Some people also develop restless legs or sleep apnea. Back pain, particularly deep pain below the rib cage, can sometimes signal kidney infection or stones. While not all back pain is kidney-related, persistent pain combined with other symptoms shouldn't be ignored. Cold sensitivity is another subtle sign. Anemia related to kidney disease can make you feel cold even in warm environments. Frequent infections, especially urinary tract infections, may also point to kidney problems. Repeated infections can both cause and result from kidney damage. Finally, general feelings of being unwell, low energy, headaches, dizziness, or just not feeling like yourself can be your body's way of signaling that something deeper is wrong. Here's the truth. Kidney disease doesn't usually scream for attention. It whispers. And those whispers show up as small, visible signs we often ignore. The good news is early detection makes a huge difference. If you recognize several of these symptoms, don't panic, but don't ignore them either. Talk to a healthcare professional, get your kidneys checked, and take control of your health. If this video helped you understand your body better, make sure to like, subscribe, and share it with someone you care about. You never know who might need this information today. Your health matters, and listening to your body is the first step. Kidney disease often develops silently, and that is what makes it so dangerous. Unlike many illnesses that announce themselves loudly with pain or obvious discomfort, kidney problems can grow quietly in the background while a person feels mostly fine. The kidneys are incredibly resilient organs, capable of compensating for damage for a long time. Because of this, a large portion of kidney function can be lost before noticeable symptoms appear. Many people assume that if something were seriously wrong, they would feel intense pain or become visibly ill, but kidney disease does not usually work that way. Instead, it progresses slowly, subtly, and often unnoticed, allowing damage to accumulate over months or even years. This silent progression is one of the main reasons kidney disease is frequently diagnosed at later stages. Early on, the body adapts to reduced kidney function, masking the problem. Waste products that should be filtered out may start building up in the blood, but the rise is gradual enough that the body adjusts. A person might feel slightly more tired than usual, but they attribute it to stress, work, or aging. They might notice minor swelling or changes in urination, but dismiss it as dehydration or something temporary. These small signals are easy to ignore, especially in a busy daily life where health often takes a back seat until something feels urgent. Another reason kidney disease goes unnoticed is that many of its early warning signs are vague and overlap with common, less serious issues. Fatigue, headaches, poor concentration, or changes in sleep patterns are things most people experience at some point. Because these symptoms are so common, they rarely trigger alarm bells. People often self-manage by resting more, drinking coffee, or adjusting their routine, never realizing that their kidneys may be under strain. The lack of sharp pain or dramatic symptoms creates a false sense of security, making it easy to believe everything is fine when it is not. The kidneys also play a role in regulating blood pressure, producing red blood cells, and balancing minerals in the body. When they begin to fail, the effects ripple throughout the body, but again, these changes happen gradually. Blood pressure may slowly rise over time, and because high blood pressure itself often has no symptoms, it can quietly worsen kidney damage while remaining undetected. Anemia can develop as the kidneys produce less of the hormone that helps make red blood cells, leading to weakness and cold sensitivity, but many people assume they are simply run down or not eating well. Each symptom on its own seems manageable and minor, which is why the bigger picture is so often missed. Lifestyle and underlying health conditions also contribute to the silent nature of kidney disease. People with diabetes, high blood pressure, obesity, or a family history of kidney problems are at higher risk, yet many feel perfectly fine in the early stages. Even when routine blood or urine tests show subtle changes, they may not cause immediate symptoms, so follow-ups are delayed or ignored. Without regular health screenings, especially for those at higher risk, kidney damage can progress quietly until it reaches a critical point. There is also a psychological element at play. Many people avoid thinking about serious health problems unless they are forced to. When symptoms are mild or inconsistent, it is easier to deny that something could be wrong. People convince themselves that they are overthinking or being overly anxious. This mindset, combined with the quiet nature of kidney disease, allows it to advance unchecked. By the time more obvious symptoms appear, such as severe swelling, significant changes in urination, or extreme fatigue, kidney function may already be significantly reduced. The danger of this silence is that kidney disease is much easier to manage when caught early. Early stages often allow for lifestyle changes, medication, and careful monitoring that can slow or even halt progression. Once the disease advances, treatment options become more limited and more invasive, sometimes leading to dialysis or the need for a transplant. The difference between early and late detection can mean the difference between maintaining a normal quality of life and facing life-altering medical interventions. Modern life also contributes to delayed recognition. Busy schedules, reliance on quick fixes, and limited access to regular healthcare visits all play a role. People may ignore routine checkups or skip blood tests because they feel healthy. Without those tests, kidney disease remains invisible. Unlike conditions that produce obvious external symptoms early on, kidney disease often requires lab work to detect changes in creatinine levels, protein in the urine, or filtration rates. Without these measurements, the disease can remain hidden. Understanding that kidney disease whispers rather than shouts is crucial. The body often sends subtle signals long before a crisis occurs, But recognizing those signals requires awareness and attention. Learning that kidney disease can exist without pain or dramatic symptoms challenges the common belief that feeling okay means being healthy. It highlights the importance of paying attention to small, persistent changes and not dismissing them too quickly. Awareness alone can prompt earlier testing, conversations with healthcare providers, and proactive steps toward protecting kidney health. When people finally learn they have kidney disease, many look back and realize the signs were there all along. The extra trips to the bathroom at night, the swelling that came and went, the fatigue that never fully resolved, the blood pressure readings that kept creeping higher. At the time, none of these felt urgent, but together they were painting a clear picture. The silence of kidney disease is not an absence of warning, but rather a series of quiet hints that are easy to overlook without knowledge and awareness. Recognizing that kidney disease often develops silently changes how we approach our health. It encourages regular checkups even when we feel fine and makes us more attentive to subtle changes in our bodies. It reminds us that prevention and early detection are powerful tools, especially for conditions that do not announce themselves loudly. By understanding this silent progression, people can move from reactive care to proactive care, giving their kidneys a better chance to function well for as long as possible. Changes in urination are often one of the earliest and most visible signs that something may be wrong with the kidneys, yet they are also some of the most commonly ignored signals. Because urination is such a routine part of daily life, subtle changes can easily go unnoticed or dismissed as temporary issues caused by hydration, diet, stress, or aging. However, the kidneys are directly responsible for producing urine, filtering waste, and maintaining fluid balance in the body. So when their function begins to decline, urine is often the first place where problems show up. One of the most common changes people experience is an increase in how often they need to urinate, especially at night. Waking up multiple times to use the bathroom may seem like a normal inconvenience, particularly for older adults, but it can be a sign that the kidneys are struggling to concentrate urine properly. When kidney filters are damaged, they may allow more fluid to pass through, leading to more frequent urination. Over time, this can disrupt sleep, increase fatigue, and signal that the kidneys are under stress long before other symptoms appear. On the other end of the spectrum, some people notice they are urinating much less than usual. Reduced urine output can indicate that the kidneys are no longer filtering waste effectively or that fluid is being retained in the body. This can be especially concerning when paired with swelling in the legs, ankles, feet, or face. A sudden drop in urine output should never be ignored, as it may suggest a significant decline in kidney function that requires immediate medical attention. Changes in the appearance of urine are another critical warning sign. Healthy urine is typically light yellow and clear, but kidney problems can cause noticeable differences. Foamy or bubbly urine is often a sign of excess protein leaking into the urine, which happens when kidney filters are damaged. While occasional foam can be caused by forceful urination, persistent foam that does not disappear quickly is a strong indicator that the kidneys may not be functioning properly. Protein in the urine is one of the earliest laboratory signs of kidney disease and often appears before a person feels unwell. Dark-colored urine can also be a cause for concern. While dehydration can make urine appear darker, consistently dark, brown, or tea-colored urine may indicate the presence of blood or waste products that the kidneys are failing to remove efficiently. In some cases, blood in the urine may be visible as a pink, red, or cola-colored tint. This is a serious sign that should never be ignored, as it can point to kidney disease, infections, stones, or other urinary tract issues. Even small amounts of blood that are not visible to the naked eye can be detected through urine tests and may signal early kidney damage. The smell of urine can also change when kidney problems are present. A strong, ammonia-like odor may occur when waste products build up in the body. While certain foods and medications can affect urine odor, a persistent unusual smell combined with other changes should raise concern. Infections, which are more common when kidney function is compromised, can also cause foul-smelling urine and should be addressed promptly to prevent further damage. Pain or discomfort during urination is another symptom that people often associate only with infections, but it can also be linked to kidney issues. Burning sensations, pressure, or pain may indicate urinary tract infections that, if left untreated, can spread to the kidneys and cause lasting damage. Recurrent infections are especially concerning, as they can both signal and contribute to declining kidney health. Frequent infections suggest that the urinary system is not functioning optimally and deserves further evaluation. Urgency is another change that can appear early. Feeling a sudden, intense need to urinate, even when the bladder is not full, may be linked to irritation or infection within the urinary system. While urgency is commonly associated with bladder issues, it can also reflect underlying kidney problems, especially when combined with changes in urine appearance or frequency. Ignoring this symptom can allow infections or inflammation to worsen and potentially affect kidney tissue. Dribbling or difficulty fully emptying the bladder may also occur in some individuals with kidney or urinary tract issues. Incomplete emptying can lead to urine retention, increasing the risk of infections and further stressing the kidneys. Over time, this can create a cycle where poor urine flow contributes to damage, and damage further worsens urine flow. What makes changes in urination particularly dangerous is how easy they are to rationalize away. People often blame increased urination on drinking more water or caffeine, and reduced urination on sweating or dehydration. Color changes are blamed on vitamins or food, and mild discomfort is brushed off as temporary irritation. Without awareness, these explanations delay medical evaluation and allow kidney damage to progress silently. Regularly observing urine may seem uncomfortable or unnecessary, but it is one of the simplest ways to monitor kidney health. Urine reflects how well the kidneys are filtering blood and balancing fluids. Persistent changes are not random and rarely happen without a reason. The kidneys are resilient, but once damage progresses beyond a certain point, it cannot be reversed, only managed. That is why early attention to urination changes is so important. When people finally receive a kidney-related diagnosis, many recall that their urination had been changing long before they sought help. The signs were visible every day, but without knowledge, they lacked meaning. Understanding that urination patterns, color, foam, smell, and frequency are powerful indicators of kidney health can shift how people respond to these early signals. Instead of dismissing them, they can act sooner, seek testing, and protect their kidneys before serious damage occurs. Swelling in the body is one of the most visible and telling signs that the kidneys may not be functioning properly, yet it is often misunderstood or overlooked. The kidneys play a critical role in maintaining the balance of fluids in the body. When they are healthy, excess fluid and sodium are filtered out through urine. When kidney function begins to decline, this balance is disrupted, causing fluid to accumulate in tissues rather than being eliminated. This buildup of fluid is what leads to swelling, also known as edema, and it can appear gradually or suddenly depending on how quickly kidney function is affected. One of the most common areas where kidney-related swelling appears is around the eyes, especially in the morning. Puffiness around the eyes is sometimes dismissed as lack of sleep, allergies, or crying, but persistent or worsening puffiness can be a sign that the kidneys are leaking protein into the urine. Protein helps keep fluid in the bloodstream, and when it is lost, fluid shifts into surrounding tissues, causing noticeable swelling. Because the skin around the eyes is thin and sensitive, even small amounts of fluid retention can become very visible there. Swelling in the ankles and feet is another classic warning sign. Gravity causes fluid to settle in the lower parts of the body, making the ankles, feet, and sometimes the lower legs swell as the day goes on. Shoes may feel tighter than usual. Socks may leave deep marks in the skin, and standing or walking may become uncomfortable. Many people attribute this type of swelling to standing too long, hot weather, or weight gain. But when it becomes frequent or persistent, kidney health should be considered. In kidney disease, this swelling does not always fully resolve overnight and may gradually worsen over time. Hands and fingers can also become swollen when the kidneys are not removing excess fluid effectively. Rings may feel tight or become difficult to remove, and fingers may appear puffy or stiff, especially in the morning. This can interfere with everyday tasks and is often mistaken for arthritis or inflammation. However, when swelling occurs in multiple areas of the body, it suggests a systemic issue rather than a localized problem, pointing toward kidney dysfunction. Facial swelling beyond the eyes can also occur, giving the face a fuller or rounder appearance. This can be subtle at first, making it hard to recognize as a medical issue. Over time, the swelling may become more pronounced and harder to ignore. Because facial swelling affects appearance, it can cause emotional distress and self-consciousness, yet many people still fail to connect it to their kidneys. In more advanced cases, fluid retention can extend beyond visible swelling and affect internal organs. Fluid may accumulate in the abdomen, causing bloating or a feeling of fullness, even without significant weight gain from food. Some people notice rapid weight gain over a short period, which is not due to fat but to retained fluid. This type of weight gain can be misleading and frustrating as diet and exercise changes do not seem to help. Fluid buildup can also reach the lungs, leading to shortness of breath or difficulty breathing, especially when lying down. This is a serious sign that requires immediate medical attention. While this symptom may not be visible in the same way as swollen ankles or hands, it is still directly linked to the kidney's inability to regulate fluid balance. At this stage, kidney function may already be significantly compromised. What makes kidney-related swelling particularly dangerous is that it often develops slowly and painlessly. Unlike swelling caused by injury or infection, which is usually painful and localized, edema from kidney disease is often soft, painless, and widespread. Pressing on swollen skin may leave a dent that lingers for several seconds, a sign known as pitting edema. Because it does not hurt, people are less likely to see it as urgent. Another reason swelling is ignored is that it can come and go, especially in the early stages of kidney disease. A person may notice swelling one day and find it reduced the next, leading them to believe it was temporary. However, these fluctuations can mask an underlying problem that is steadily progressing. Over time, the swelling tends to become more consistent and severe as kidney function continues to decline. Dietary habits can also worsen swelling when kidneys are compromised. Excess sodium intake causes the body to retain more water, amplifying fluid buildup. People may notice that swelling worsens after eating salty foods, but instead of viewing this as a warning sign, they often simply try to cut back on salt without addressing the underlying kidney issue. While reducing sodium can help manage symptoms, it does not reverse kidney damage. Swelling related to kidney disease is not just a cosmetic or comfort issue. It reflects a deeper imbalance in the body's ability to regulate fluids, electrolytes, and proteins. This imbalance places strain on the heart, blood vessels, and other organs, increasing the risk of complications such as high blood pressure and heart disease. The longer swelling persists without evaluation, the greater the potential for long-term damage. Many people only seek medical help when swelling becomes severe or interferes with daily life. By that point, kidney disease may already be in an advanced stage. Early recognition of subtle swelling allows for earlier testing, diagnosis, and intervention, which can slow progression and improve outcomes. Paying attention to changes in how clothes fit, how the body looks in the mirror, and how it feels throughout the day can provide valuable clues about kidney health. Understanding that swelling in the eyes, face, hands, ankles, and feet is not always harmless changes how people respond to the symptom. Instead of accepting it as a normal part of aging or lifestyle, it becomes a signal worth investigating. The body often reveals kidney problems through fluid retention long before more dramatic symptoms appear, making swelling one of the most important visible signs that should never be ignored. Constant fatigue, weakness, and mental fog are some of the most common yet misunderstood signs of kidney disease, largely because they are so easy to blame on everyday life. Stress, lack of sleep, busy schedules, aging, and emotional pressure are often seen as the obvious causes, so when someone feels tired all the time, they rarely think of their kidneys. But healthy kidneys play a key role in keeping the blood clean, balanced, and oxygenated, and when they begin to fail, the entire body feels the impact. This fatigue is not the kind that goes away after a good night's sleep or a weekend of rest. It tends to linger, gradually becoming part of daily life until it feels normal, even though it is not. One of the main reasons kidney disease causes persistent fatigue is the buildup of waste and toxins in the bloodstream. When kidneys are functioning properly, they filter out harmful substances and excess fluids, keeping the internal environment stable. As kidney function declines, these waste products begin to accumulate. Even small increases in toxins can interfere with how cells produce energy, leaving the body feeling drained. Muscles may feel heavy, movements may require more effort, and simple tasks can become exhausting. This type of fatigue is often described as a deep, whole-body tiredness, rather than just feeling sleepy. Another major contributor to weakness and fatigue in kidney disease is anemia. Healthy kidneys produce a hormone called erythropoietin, which signals the bone marrow to make red blood cells. These red blood cells carry oxygen to tissues throughout the body. When kidney function declines, production of this hormone decreases, leading to fewer red blood cells and lower oxygen delivery. As a result, muscles and organs do not get the oxygen they need to function efficiently. This leads to weakness, shortness of breath with minimal exertion, dizziness, and a constant feeling of low energy. People may notice that activities they once handled easily now leave them feeling worn out. Mental fog, difficulty concentrating, and memory problems are also closely linked to kidney-related fatigue. The brain is highly sensitive to changes in blood chemistry. When waste products remain in the bloodstream, they can interfere with normal brain function. People may find it harder to focus, process information, or remember details. Tasks that require mental clarity may feel overwhelming, and decision-making can become slower. This cognitive fog is frustrating and often leads people to worry about stress, anxiety, or even early cognitive decline, without realizing that their kidneys may be contributing to the problem. Sleep disturbances further worsen fatigue in people with kidney disease. Toxin buildup can interfere with normal sleep patterns, making it difficult to fall asleep or stay asleep. Some individuals experience restless legs, frequent nighttime urination, or discomfort that disrupts rest. Even when they spend enough time in bed, the sleep they get is often not restorative. Waking up feeling unrefreshed becomes common, and daytime fatigue intensifies. This creates a cycle where poor sleep worsens fatigue, and fatigue makes it harder to maintain healthy routines. Muscle weakness is another aspect of kidney-related fatigue that is often overlooked. Kidneys help regulate electrolyte levels such as potassium, calcium, and phosphorus, which are essential for muscle function. When these minerals become imbalanced, muscles may feel weak, shaky, or prone to cramping. Physical strength can gradually decline, making lifting objects, climbing stairs, or standing for long periods more difficult. This loss of strength can happen slowly, so people adjust their behavior without realizing that an underlying medical issue is responsible. Emotional and psychological effects also play a role. Living with constant fatigue can lead to irritability, low mood, and decreased motivation. People may withdraw from social activities or hobbies they once enjoyed because they simply do not have the energy. Over time, this can affect mental health, leading to feelings of frustration or hopelessness. Because kidney disease often goes undiagnosed in its early stages, people may blame themselves for feeling lazy or unmotivated, not realizing that their body is struggling internally. What makes fatigue related to kidney disease particularly dangerous is how early it can appear and how easily it blends into everyday life. It does not usually arrive suddenly or dramatically. Instead, it creeps in slowly, increasing over time. People adapt by pushing through, drinking more caffeine, or cutting back on activities, which masks the severity of the problem. By the time fatigue becomes severe enough to interfere significantly with daily functioning, kidney damage may already be advanced. Underlying conditions such as diabetes and high blood pressure, which are common causes of kidney disease, can also contribute to fatigue, making it even harder to pinpoint the source. This overlap often delays diagnosis, as symptoms are attributed to known conditions rather than kidney involvement. Without blood and urine tests, the true cause remains hidden. Understanding the connection between kidney health and energy levels changes how persistent fatigue is viewed. It highlights the importance of not ignoring long-lasting tiredness that does not improve with rest or lifestyle changes. Fatigue is not always a normal part of aging or a sign of being busy. When it is constant, unexplained, and accompanied by weakness or mental fog, it deserves attention. Many people diagnosed with kidney disease later realize that fatigue was one of their earliest symptoms. They recall months or years of feeling drained, struggling to concentrate, and lacking strength, all while assuming it was just life catching up with them. Recognizing fatigue as a possible warning sign allows for earlier testing, diagnosis, and treatment, which can significantly improve quality of life and slow disease progression. The body often signals kidney trouble through a steady loss of energy and clarity long before more dramatic symptoms appear. Listening to these signals requires awareness and a willingness to question what feels normal. When fatigue becomes a constant companion rather than an occasional feeling, it may be the kidneys quietly asking for attention. Dry, itchy, pale, or yellowish skin can be an outward reflection of what is happening deep inside the body when the kidneys are no longer functioning properly. The skin is often thought of as just a protective outer layer, but it is closely connected to internal health, especially kidney health. When kidneys are working well, they help maintain the right balance of minerals, fluids, and waste products in the blood. When that balance is disrupted, the skin is one of the first places where visible changes can appear, sometimes long before a person realizes there is a serious internal problem. One of the most common skin-related signs of kidney disease is persistent dryness. This dryness is different from occasional dry skin caused by weather or dehydration. It tends to be constant, widespread, and resistant to moisturizers. The kidneys help regulate fluid levels in the body, and when they fail to do so effectively, the skin can lose moisture from within. Even drinking plenty of water may not improve the dryness, because the issue is not intake but filtration and balance. The skin may feel tight, rough, or flaky, and over time it can become more sensitive and prone to cracking. Itching often accompanies dry skin in kidney disease and can become severe. This itching is not caused by allergies or irritation on the surface of the skin, but by a buildup of waste products and imbalances in minerals like phosphorus and calcium in the blood. When kidneys cannot filter these substances properly, they accumulate and irritate nerve endings in the skin. The itching may be generalized, affecting large areas of the body, or it may feel deep and internal, making it hard to relieve with scratching. Many people describe it as relentless, interfering with sleep and daily comfort. What makes kidney-related itching especially frustrating is that there may be no visible rash or redness at first. The skin can look relatively normal while feeling intensely uncomfortable. Over time, constant scratching can lead to sores, thickened skin, and infections, further complicating the problem. People may try creams, antihistamines, or home remedies without relief, unaware that the root cause lies in kidney dysfunction rather than a skin condition. Pale skin is another visible change that can signal kidney disease. This paleness is often linked to anemia, a common complication of declining kidney function. Healthy kidneys produce a hormone that stimulates the production of red blood cells, which gives skin its healthy color by delivering oxygen to tissues. When kidney function declines, fewer red blood cells are produced, and oxygen delivery drops. As a result, the skin may appear pale, dull, or washed out. Lips, gums, and the inside of the eyelids may also look lighter than usual. This paleness is not just cosmetic. It reflects reduced oxygen throughout the body, contributing to fatigue, weakness, and shortness of breath. Because changes in skin tone can be gradual, people often do not notice them until someone else points them out or they compare older photos. By then, anemia and kidney damage may already be well established. In some cases, the skin may take on a yellowish or grayish tint. This happens when waste products that should be removed by the kidneys remain in the bloodstream and affect skin pigmentation. The yellowish tone is sometimes mistaken for jaundice or liver problems, but it can also be related to advanced kidney disease. This discoloration can make the skin look unhealthy or aged and may be accompanied by itching and dryness, making it even more uncomfortable. Another visible skin change linked to kidney problems is increased sensitivity and bruising. When the kidneys are not functioning well, they can affect platelet function and blood vessel health, making the skin more prone to bruises or slow healing. Small bumps or scratches may take longer to heal, and the skin may feel thinner or more fragile. These changes are subtle but become more noticeable over time. Mineral imbalances caused by kidney disease can also lead to calcium deposits in the skin, which may appear as small, hard nodules. While not always visible in early stages, they can become noticeable as kidney function worsens. These deposits can be uncomfortable and contribute to itching and irritation. The emotional impact of skin changes should not be underestimated. Skin is closely tied to self-image, and visible changes can affect confidence and social comfort. People may feel embarrassed by constant scratching, flaky skin, or changes in complexion. This can lead to social withdrawal and emotional distress, especially when the cause is unknown and treatments do not seem to work. One of the reasons skin symptoms are overlooked is that they are often attributed to aging, climate, or skincare habits. Dry skin is common, especially in older adults, and itching is often blamed on allergies or soaps. Without awareness of the kidney connection, these symptoms are treated superficially rather than investigated medically. This delay allows kidney disease to progress quietly in the background. Skin changes related to kidney disease are not just external inconveniences. They are signals of internal imbalance and declining filtration. When waste products, fluids, and minerals are not regulated properly, the skin reflects that struggle. Paying attention to persistent dryness, itching, unusual paleness, or yellowish tones can provide valuable clues about kidney health. Many people diagnosed with kidney disease later realized that their skin had been changing for a long time. The constant dryness, the itching that never fully went away, the dull or pale appearance they tried to cover with skincare products or makeup. At the time, these changes seemed minor or cosmetic, but in hindsight, they were early warnings. Understanding that the skin can reveal kidney trouble encourages a more holistic view of health. Instead of treating skin symptoms in isolation, it becomes important to consider what the body may be signaling internally. When skin changes are persistent, widespread, and unexplained, they deserve medical attention, not just cosmetic solutions. The body often speaks quietly through the skin, offering visible clues long before kidney disease reaches a critical stage. Sudden or unexplained changes in weight, along with nausea, vomiting, and loss of appetite, can be powerful yet misunderstood signals that the kidneys may not be functioning properly. Weight is something many people monitor closely, but when it changes without clear reasons like diet or exercise, it is often confusing and easy to misinterpret. In kidney disease, weight changes are rarely about body fat. Instead, they are usually related to fluid imbalance, toxin buildup, and disruptions in how the body processes nutrients and waste, all of which can occur quietly as kidney function declines. Rapid weight gain is one of the most common weight-related signs of kidney problems. This gain can happen over days or weeks, and is often caused by fluid retention rather than increased calorie intake. When the kidneys are unable to remove excess fluid and sodium efficiently, water accumulates in the body. This fluid can collect in the legs, ankles, feet, hands, face, and even the abdomen. The scale may suddenly show several extra pounds, but clothes may feel tight in unusual ways, and the body may look swollen rather than heavier in a typical sense. This kind of weight gain can be frustrating because it does not respond to diet changes or exercise, leaving people confused about why their weight is increasing. Fluid-related weight gain can fluctuate, making it even harder to recognize as a medical issue. Some days the swelling in weight may seem less noticeable, while other days they worsen, especially after consuming salty foods. This inconsistency often leads people to dismiss the problem as temporary bloating or water retention, not realizing it may be linked to kidney dysfunction. Over time, as kidney function continues to decline, the weight gain becomes more persistent and pronounced. On the other side, unexplained weight loss can also occur in kidney disease and is equally concerning. As waste products build up in the blood, they can affect digestion and appetite. Many people begin to feel full quickly, or lose interest in food altogether. This loss of appetite is not intentional and can develop gradually, making it easy to overlook at first. Favorite foods may no longer seem appealing, and meals may feel like a chore rather than a pleasure. Nausea is a common companion to appetite loss in kidney disease. As toxins accumulate in the bloodstream, they irritate the digestive system and the brain's nausea centers. This can lead to persistent queasiness, especially in the morning or after eating. Some people experience vomiting, which further reduces their ability to maintain proper nutrition and hydration. These symptoms are often mistaken for stomach bugs, food intolerance, acid reflux, or stress, particularly when they come and go. The metallic or unpleasant taste in the mouth that often accompanies kidney disease can further reduce appetite. Food may taste different, bitter, or bland, making eating less enjoyable. Bad breath caused by waste buildup can also contribute to nausea and aversion to food. Over time, reduced calorie and protein intake can lead to muscle loss, weakness, and further weight loss, compounding the effects of kidney disease. Weight loss related to kidney disease is often gradual but steady. Clothes may become looser, and muscle tone may decrease. Because the process is slow, people may not realize how much weight they have lost until it becomes noticeable or someone else points it out. This type of weight loss is not healthy and reflects the body's struggle to cope with toxin overload and poor nutrient balance. Nausea and vomiting can also disrupt daily life and emotional well-being. Constant discomfort around eating can lead to anxiety about meals and social situations involving food. People may avoid eating with others or skip meals altogether to prevent feeling sick. This can lead to isolation and further nutritional deficiencies, weakening the body's ability to cope with illness. Another factor contributing to these symptoms is the role of the kidneys in regulating hormones and metabolism. When kidney function declines, hormonal imbalances can affect hunger signals and how the body uses energy. This can alter metabolism in unpredictable ways, contributing to both weight gain from fluid retention and weight loss from reduced intake and muscle breakdown. What makes these symptoms particularly dangerous is how easily they are misattributed. Weight gain is often blamed on aging or inactivity, while weight loss may be praised or dismissed as stress-related. Nausea and appetite loss are commonly linked to digestive issues, medications, or temporary illnesses. Without awareness of kidney involvement, people may treat these symptoms individually rather than recognizing them as part of a larger pattern. Medications used to manage other conditions can also complicate the picture. Some drugs affect appetite, digestion, or fluid balance, making it harder to distinguish side effects from kidney-related symptoms. However, persistent or worsening changes, especially when multiple symptoms occur together, should raise concern. These weight and appetite changes are not just uncomfortable side effects. They reflect deeper problems with waste removal, fluid regulation, and nutritional balance. Left unaddressed, they can accelerate physical decline, weaken the immune system, and reduce quality of life. Poor nutrition and ongoing vomiting can also worsen kidney function, creating a harmful cycle. Many people diagnosed with kidney disease later recall long periods of unexplained bloating, rapid weight gain, or a gradual loss of appetite that they ignored. At the time, these symptoms seemed manageable or unrelated, but in hindsight, they were early warnings. Recognizing sudden or unexplained weight changes, persistent nausea, vomiting, and appetite loss as possible kidney-related signs allows for earlier evaluation and intervention. Paying attention to how the body responds to food, how weight changes over time, and whether nausea or appetite loss persists can provide valuable clues about kidney health. These symptoms are the body's way of signaling imbalance and distress, often appearing well before more dramatic complications develop. When weight and appetite change without a clear explanation, it may be the kidneys quietly struggling to maintain balance and asking for attention. Shortness of breath is a symptom that most people immediately associate with lung or heart problems, so it rarely leads them to think about their kidneys. Yet the kidneys play a quiet but essential role in maintaining fluid balance and healthy blood composition, and when they begin to fail, breathing can become noticeably more difficult. This change may start subtly, showing up only during physical activity or when lying down, and gradually worsen over time. Because it does not usually appear suddenly or dramatically, it is often overlooked or blamed on poor fitness, aging, weight gain, anxiety, or seasonal illness. One of the main ways kidney disease leads to shortness of breath is through fluid overload. Healthy kidneys remove excess water and sodium from the body through urine. When kidney function declines, this fluid begins to accumulate instead of being eliminated. While some of this extra fluid is visible as swelling in the legs, ankles, or face, some of it can collect in the lungs. This condition makes it harder for the lungs to expand fully and exchange oxygen effectively. As a result, breathing can feel shallow, labored, or uncomfortable, especially during exertion or when lying flat. Many people first notice this kind of breathlessness when climbing stairs, walking longer distances, or doing activities that were previously easy. They may find themselves stopping more often to catch their breath or feeling winded after minimal effort. At first, this change may seem minor and easy to ignore. Over time, however, it can progress to the point where even basic activities like walking across a room or talking for extended periods feel tiring. Another common sign is difficulty breathing when lying down, particularly at night. People may feel more comfortable sleeping propped up on pillows, or may wake up suddenly feeling short of breath. This happens because fluid shifts within the body when lying flat, making it easier for fluid to move into the lungs. Nighttime breathlessness can severely disrupt sleep, leading to daytime fatigue and further reducing quality of life. Many people assume this symptom is related to acid reflux, anxiety, or sleep apnea, without considering kidney involvement. Anemia is another major factor linking kidney disease to shortness of breath. As kidney function declines, production of the hormone that stimulates red blood cell formation decreases. Fewer red blood cells mean less oxygen is delivered to tissues throughout the body. Even if the lungs are functioning normally, the blood cannot carry enough oxygen to meet the body's needs. This causes a sensation of breathlessness, especially during activity, because the body is struggling to compensate for low oxygen delivery. Anemia-related breathlessness often comes with other symptoms such as weakness, dizziness, fatigue, and pale skin. People may notice their heart beating faster as it tries to pump more blood to deliver oxygen. This increased strain on the heart can worsen existing heart conditions or contribute to new ones, creating a complex interaction between kidney disease, heart health, and breathing. Toxin buildup in the blood can also affect breathing indirectly. When kidneys fail to remove waste products efficiently, these toxins can alter the body's acid-base balance. This can lead to a condition where the blood becomes more acidic, prompting faster or deeper breathing as the body tries to restore balance. People may feel like they cannot take a satisfying breath or that their breathing is unusually rapid, even at rest. Shortness of breath can be particularly frightening because it creates a sense of urgency and loss of control. Even mild breathlessness can trigger anxiety, which in turn worsens breathing discomfort. This emotional response can make it difficult to determine the underlying cause, as anxiety and kidney-related breathlessness can reinforce each other. Without proper evaluation, people may focus on managing anxiety symptoms while the kidney problem continues to progress unnoticed. Another reason this symptom is often misinterpreted is that kidney disease frequently coexists with other conditions that affect breathing, such as high blood pressure, heart disease, or diabetes. When breathlessness appears, it is often attributed to these known conditions, delaying investigation into kidney function. While these conditions are closely connected, kidney involvement is sometimes overlooked despite playing a central role in fluid regulation and blood health. Environmental factors and lifestyle habits can further mask kidney-related breathlessness. Poor physical conditioning, smoking history, allergies, or recent respiratory infections can all seem like plausible explanations. Because kidney disease progresses gradually, people adjust their activity levels without realizing it, avoiding exertion that makes them feel breathless. This adaptation hides the severity of the problem until breathing becomes noticeably difficult even at rest. As kidney disease advances, breathlessness can become more frequent and severe. Fluid accumulation in the lungs can reach a point where it causes coughing, wheezing, or a feeling of heaviness in the chest. These symptoms may mimic asthma or bronchitis, leading to treatments that do not address the underlying issue. Without proper kidney evaluation, the true cause remains untreated. The impact of chronic shortness of breath goes beyond physical discomfort. It can limit independence, reduce mobility, and increase fear of physical activity. People may avoid exercise, social outings, or even routine tasks, leading to muscle weakness and further decline. This reduced activity can worsen overall health and accelerate complications associated with kidney disease. What makes shortness of breath such an important warning sign is that it often indicates significant changes in fluid balance or blood oxygenation. While it can appear in earlier stages, it is more common as kidney disease progresses, making it a signal that should never be ignored. Early recognition can prompt testing that reveals fluid overload, anemia, or declining kidney function before more severe complications develop. Many people diagnosed with kidney disease later recall episodes of unexplained breathlessness that they dismissed or attributed to other causes. At the time, the symptom felt inconvenient but not alarming enough to seek medical attention. In hindsight, it was the body signaling that internal balance was being lost. Understanding that the kidneys play a role in breathing by regulating fluid levels, supporting red blood cell production, and maintaining chemical balance helps reframe shortness of breath as more than just a lung issue. When breathing feels harder without a clear explanation, especially alongside fatigue, swelling, or changes in urination. It may be the kidneys struggling to keep up with the body's demands and quietly signaling that something is wrong. High blood pressure is often called a silent condition because it rarely causes noticeable symptoms, and this makes its connection to kidney disease particularly dangerous. The kidneys and blood pressure are deeply interconnected, each influencing the health of the other in powerful ways. When blood pressure rises, it can damage the delicate blood vessels in the kidneys, and when the kidneys are damaged, they lose their ability to regulate blood pressure effectively. This creates a vicious cycle that can progress quietly for years without clear warning signs. Healthy kidneys help regulate blood pressure by controlling fluid levels and releasing hormones that influence how blood vessels constrict or relax. When kidney function begins to decline, this balance is disrupted. The kidneys may retain excess sodium and water, increasing the volume of blood in circulation. More blood volume means more pressure pushing against blood vessel walls, leading to elevated blood pressure. At the same time, damaged kidneys may release hormones that cause blood vessels to tighten, further increasing pressure. What makes high blood pressure particularly dangerous in kidney disease is that it often goes unnoticed. Many people feel perfectly normal, even when their blood pressure is consistently high. There may be no pain, no dizziness, and no obvious discomfort. Without regular monitoring, blood pressure can remain elevated for years, slowly damaging the kidneys and other organs. By the time symptoms appear, significant kidney damage may already be present. High blood pressure damages the kidneys by injuring the tiny filtering units called nephrons. These structures rely on a network of small blood vessels to filter waste from the blood. Persistent high pressure strains these vessels, causing them to thicken, narrow, or scar. As a result, less blood reaches the filtering units, reducing their ability to remove waste and excess fluid. Over time, more nephrons are damaged or lost, further reducing kidney function. As kidney damage progresses, the kidneys become less effective at controlling blood pressure, which allows it to rise even higher. This feedback loop accelerates both conditions. Blood pressure that is difficult to control despite medication can be a warning sign that kidney function is declining. Many people require increasing doses of medication or multiple drugs to manage their blood pressure, not realizing that the underlying issue may involve their kidneys. High blood pressure related to kidney disease can also cause subtle symptoms that are easy to ignore. Some people experience headaches, especially in the morning, or a feeling of pressure in the head. Others may notice blurred vision, nosebleeds, or shortness of breath. These symptoms are often intermittent and mild, leading people to dismiss them as stress or fatigue rather than signs of a serious problem. The relationship between high blood pressure and kidney disease is especially concerning for people with diabetes, obesity, or a family history of kidney problems. These individuals are already at higher risk, and uncontrolled blood pressure can significantly accelerate kidney damage. Even moderately elevated blood pressure over time can cause harm, making early and consistent management essential. Lifestyle factors can further complicate this relationship. High sodium intake, lack of physical activity, smoking, and chronic stress can all raise blood pressure and place additional strain on the kidneys. When kidney function is already compromised, these factors have an even greater impact. People may notice that their blood pressure becomes more sensitive to dietary changes or stress, fluctuating more than it used to. One of the challenges in recognizing kidney-related high blood pressure is that routine medical visits may focus on treating the numbers rather than investigating the cause. Blood pressure medications can be effective, but without addressing kidney health, they may only manage symptoms rather than slow disease progression. Regular blood and urine tests are essential for identifying kidney involvement, especially when blood pressure is difficult to control. High blood pressure also increases the risk of other serious complications in people with kidney disease. It places additional strain on the heart, increasing the risk of heart attacks, heart failure, and strokes. It can damage blood vessels throughout the body, affecting vision, brain function, and circulation. These complications often develop alongside kidney disease, further reducing quality of life and increasing health risks. What makes this issue particularly concerning is that both high blood pressure and kidney disease can progress without obvious symptoms. People may feel relatively well while significant damage is occurring internally. This silent progression delays diagnosis and treatment, allowing the cycle of damage to continue unchecked. Many people diagnosed with kidney disease later discover that their blood pressure had been elevated for years. They may recall readings that were slightly high but not alarming, or periods when blood pressure medications were adjusted without much explanation. In hindsight, those elevated readings were early signs of kidney stress. Understanding that high blood pressure is both a cause and a consequence of kidney disease changes how it is viewed. It is not just a number to manage, but a signal that something deeper may be wrong. Monitoring blood pressure regularly and investigating persistent elevations can lead to earlier detection of kidney problems. Breaking the cycle between high blood pressure and kidney damage requires awareness, consistent monitoring, and early intervention. Lifestyle changes, medication, and medical follow-up can significantly slow progression when kidney disease is caught early. Ignoring high blood pressure, especially when it is difficult to control, allows kidney damage to worsen silently. The kidneys rely on healthy blood vessels to function, and blood pressure determines how much strain those vessels endure every day. When pressure remains high, the kidneys pay the price. Recognizing elevated blood pressure as a potential warning sign rather than just a routine measurement can make a critical difference in protecting long-term kidney health. Muscle cramps and twitching may seem like minor, everyday annoyances, but when they occur frequently or without an obvious cause, they can be important warning signs of kidney dysfunction. The kidneys play a crucial role in maintaining the delicate balance of electrolytes and minerals in the body, including potassium, calcium, sodium, and phosphorus. These minerals are essential for normal muscle contraction and nerve signaling. When kidney function declines, this balance is disrupted, leading to abnormal muscle activity that can manifest as cramps, spasms, or involuntary twitching. One of the most common complaints among people with kidney problems is painful muscle cramps, especially in the legs. These cramps often occur at night, waking people from sleep with sudden, intense pain. While occasional leg cramps can be caused by dehydration or overexertion, persistent or recurring cramps may indicate deeper issues with mineral balance. Damaged kidneys may struggle to maintain proper potassium and calcium levels, both of which are critical for muscle relaxation and contraction. When these levels are off, muscles can contract unpredictably and painfully. Twitching is another symptom that can be easily dismissed. Small, involuntary movements in the eyelids, fingers, or legs are often blamed on stress, fatigue, or caffeine. However, frequent twitching can also result from electrolyte imbalances caused by declining kidney function. Nerve cells rely on stable mineral levels to transmit signals accurately. When these signals become disrupted, muscles may respond erratically, leading to visible twitching or a sensation of internal vibration. Phosphorus imbalance is another key factor. Healthy kidneys remove excess phosphorus from the blood. When they fail to do so, phosphorus levels rise, which can interfere with calcium balance. Low calcium levels can increase nerve excitability, making muscles more prone to spasms and cramps. Over time, this imbalance can affect not only muscles but also bone health, increasing the risk of weakness and fractures. These muscle-related symptoms often worsen at night or during rest. This may be because blood flow and electrolyte distribution change when the body is at rest, making imbalances more noticeable. People may find that stretching, massaging, or drinking water provides little relief. Over-the-counter remedies may help temporarily, but the cramps often return, leaving people frustrated and exhausted. Fatigue and muscle weakness frequently accompany cramps and twitching in kidney disease. As toxins accumulate in the blood, they interfere with muscle metabolism and energy production. Muscles may feel heavy or weak, making everyday movements more difficult. This weakness can lead to reduced physical activity, which in turn worsens muscle health and increases the likelihood of cramping. Medications can also play a role in muscle symptoms, especially in people with kidney disease. Diuretics, commonly used to treat high blood pressure and fluid retention, can alter electrolyte levels and contribute to cramping. When kidney function is compromised, the body becomes more sensitive to these changes, amplifying muscle-related side effects. Without proper monitoring, medication-related imbalances can go unnoticed. Another reason muscle cramps and twitching are often overlooked is that they are so common in the general population. Many people experience cramps due to exercise, dehydration, or prolonged sitting. This familiarity makes it easy to normalize the symptom and ignore it. However, the pattern and persistence of cramps matter. When cramps occur frequently, at rest, or alongside other symptoms like fatigue, swelling, or changes in urination, they deserve closer attention. Muscle symptoms related to kidney disease can also affect quality of life in subtle but significant ways. Nighttime cramps disrupt sleep, leading to daytime fatigue and irritability. Fear of sudden pain can make people anxious about physical activity or bedtime. Over time, this can reduce mobility, independence, and overall well-being. The emotional toll of ongoing muscle discomfort should not be underestimated. Persistent cramps and twitching can create a sense of frustration and helplessness, especially when no clear cause is identified. People may try multiple remedies without success, leading to confusion and worry. Without understanding the kidney connection, they may never receive appropriate testing or treatment. As kidney disease progresses, muscle symptoms may become more severe or frequent. Electrolyte imbalances can worsen, and nerve function may be further affected. In advanced stages, muscle weakness can become pronounced, contributing to falls and injuries. These complications further highlight the importance of early recognition. Many people diagnosed with kidney disease later recall years of unexplained leg cramps or muscle twitching that they brushed off as normal. At the time, these symptoms seemed minor compared to more dramatic health issues. In hindsight, they were early signs of an internal imbalance that had been developing quietly. Understanding the role of the kidneys in muscle and nerve function changes how these symptoms are perceived. Muscle cramps and twitching are not always caused by dehydration or overuse. When they are persistent, severe, or unexplained, they may be signals that the kidneys are struggling to maintain balance. Paying attention to these seemingly small symptoms can lead to earlier detection of kidney problems. Blood tests can reveal electrolyte imbalances and kidney function changes long before more serious complications arise. Addressing these issues early can improve comfort, protect muscle and nerve health, and slow the progression of kidney disease. The body often communicates internal distress through subtle physical sensations. Muscle cramps and twitching may be the kidney's way of signaling that their ability to regulate minerals and support normal muscle function is compromised, offering an early opportunity to listen and act before greater damage occurs. Bad breath, a metallic taste in the mouth, and constant dryness are symptoms many people associate with poor oral hygiene, dehydration, or dental problems, but they can also be important signs that the kidneys are not functioning properly. The mouth is closely connected to what is happening in the bloodstream, and when the kidneys fail to remove waste products efficiently, those substances can begin to affect breath, taste, and overall oral comfort. These changes often develop gradually, making them easy to overlook or misinterpret, yet they can be among the clearest indicators that toxins are building up in the body. One of the most noticeable signs is persistent bad breath that does not improve with brushing, flossing, or mouthwash. This type of breath often has a strong, ammonia-like or urine-like odor, which comes from the accumulation of waste products such as urea in the blood. When kidney function declines, urea levels rise, and some of this waste is released through the breath. This condition is sometimes referred to as uremic breath and is very different from typical bad breath caused by food particles or bacteria in the mouth. Because the source is internal, standard dental care provides little relief. Along with bad breath, many people experience a persistent metallic or bitter taste in their mouth. Food may taste strange, dull, or unpleasant, even foods they once enjoyed. This altered sense of taste is caused by waste buildup and changes in saliva composition. When toxins circulate in the blood, they can affect taste receptors and the nerves involved in taste perception. This can make eating less enjoyable and contribute to a loss of appetite, which in turn affects nutrition and overall health. Dry mouth is another common symptom associated with kidney disease. While dehydration can cause temporary dryness, kidney-related dry mouth often persists, even when a person drinks adequate fluids. The kidneys help regulate fluid balance, and when they are not functioning well, saliva production can be affected. Medications commonly used by people with kidney disease, such as blood pressure drugs or diuretics, can further reduce saliva flow. A constantly dry mouth can be uncomfortable and increase the risk of dental problems, infections, and difficulty swallowing. The combination of bad breath, altered taste, and dry mouth can significantly affect daily life. Eating becomes less pleasurable, social interactions may feel uncomfortable, and self-confidence can suffer. People may avoid close conversations or meals with others due to embarrassment about their breath. These emotional effects often go unspoken, yet they can have a real impact on mental well-being. What makes these symptoms particularly tricky is how easily they are attributed to other causes. Bad breath is often blamed on dental issues, smoking, certain foods, or acid reflux. A metallic taste may be linked to medications, supplements, or stress. Dry mouth is frequently associated with aging, anxiety, or mouth breathing. Because these explanations seem reasonable, the possibility of kidney involvement is rarely considered, especially in the absence of more dramatic symptoms. Oral changes related to kidney disease can also increase the risk of mouth sores, infections, and gum disease. When waste products accumulate and saliva flow decreases, the mouth becomes a more favorable environment for harmful bacteria. This can lead to inflammation, bleeding gums, and slow healing of oral tissues. These issues may prompt repeated dental visits without addressing the underlying systemic problem. The buildup of toxins in the blood, known as uremia, is the underlying cause of many of these oral symptoms. As kidney function declines, the body loses its ability to filter out nitrogen-based waste products. These substances affect multiple systems, including the digestive and nervous systems, and the mouth becomes one of the places where their presence is most noticeable. The longer this buildup continues, the more pronounced the symptoms can become. These oral signs often appear alongside other subtle kidney-related symptoms, such as fatigue, nausea, or changes in urination. When viewed together, they form a pattern that points to declining kidney function. Unfortunately, when each symptom is treated in isolation, the bigger picture can be missed. Mouthwash may be used for bad breath, dietary changes for taste issues, and lozenges for dry mouth, all without addressing the root cause. As kidney disease progresses, these symptoms can intensify. Bad breath may become more noticeable, taste changes more persistent, and dryness more uncomfortable. At more advanced stages, mouth ulcers or a coated tongue may develop. These changes are not just cosmetic or minor annoyances. They reflect significant metabolic imbalance and toxin overload in the body. Many people diagnosed with kidney disease later recall long periods of unexplained bad breath or strange tastes that they tried to manage on their own. At the time, these symptoms seemed minor compared to other health concerns. In hindsight, they were early signals that the kidneys were struggling to keep the blood clean. Understanding the connection between kidney health and oral symptoms can change how these signs are perceived. When bad breath does not respond to good oral hygiene, when food consistently tastes metallic or bitter, or when dry mouth becomes a constant problem, it may be time to look beyond the mouth itself. These symptoms can be the body's way of signaling that waste products are accumulating and that kidney function may be compromised. Paying attention to changes in breath, taste, and mouth comfort encourages a more holistic approach to health. The mouth often reflects internal imbalances, and kidney disease is one condition where this connection is particularly strong. Recognizing these signs early can prompt medical evaluation, blood and urine testing, and timely intervention, helping to protect kidney function and overall well-being. Back pain, frequent infections, cold sensitivity, and sleep problems may seem unrelated at first, but when they appear together or persist without a clear explanation, they can be important indicators of kidney dysfunction. These symptoms often develop gradually and are easily attributed to lifestyle factors, stress, aging, or minor illnesses. Because they do not always feel severe or urgent, they are commonly ignored, allowing underlying kidney issues to progress quietly over time. Back pain related to the kidneys is often different from typical muscle or spine pain. It is usually felt deep in the body on one or both sides of the lower back, just below the rib cage. This pain may be dull and constant or sharp and sudden, depending on the cause. Kidney infections, inflammation, or stones can all produce back pain, but even chronic kidney disease can cause discomfort due to swelling or pressure within the kidneys. Because lower back pain is extremely common, people often assume it is caused by posture, physical strain, or prolonged sitting, overlooking the possibility of kidney involvement. Unlike muscle-related back pain, kidney-related pain does not always improve with rest, stretching, or changes in position. It may be accompanied by other symptoms such as fever, nausea, changes in urination, or fatigue, but these connections are not always immediately obvious. When pain persists or recurs without a clear mechanical cause, it deserves closer attention. Frequent infections, especially urinary tract infections, are another warning sign that the kidneys may be under stress. The urinary system is designed to flush out bacteria, but when kidney function is compromised, this defense system becomes less effective. Bacteria can more easily multiply and spread, leading to repeated infections. These infections may start in the bladder but can travel upward to the kidneys, causing more serious complications and further damage. People with recurring urinary infections may experience burning during urination, urgency, cloudy or foul-smelling urine, and lower abdominal discomfort. Over time, repeated infections can scar kidney tissue, reducing filtering capacity. In some cases, infections occur with mild or atypical symptoms, especially in older adults, making them harder to detect and treat promptly. Cold sensitivity is another subtle symptom that often goes unnoticed. People with kidney disease may feel cold more easily than others, even in warm environments. This is commonly linked to anemia, a frequent complication of kidney dysfunction. As kidney function declines, production of the hormone that stimulates red blood cell formation decreases. Fewer red blood cells mean less oxygen delivery and reduced heat generation in the body, leading to a constant feeling of being cold. This cold sensitivity can be frustrating and confusing. People may layer clothing, adjust thermostats, or blame poor circulation, not realizing that their kidneys may be contributing to the problem. Cold hands and feet, chills without fever, or a general intolerance to cold can all be signs of reduced oxygenation and slowed metabolism associated with kidney disease. Sleep problems are another common but overlooked symptom. Toxin buildup in the bloodstream can interfere with the body's ability to relax and rest properly. People with kidney disease often struggle with falling asleep, staying asleep, or feeling rested upon waking. Restless leg syndrome is particularly common, causing uncomfortable sensations and an urge to move the legs at night. This condition is linked to iron deficiency, nerve changes, and toxin accumulation, all of which can occur with declining kidney function. Frequent nighttime urination also disrupts sleep. As kidneys lose their ability to concentrate urine, they may produce more urine at night, forcing people to wake up multiple times. This fragmented sleep leads to daytime fatigue, irritability, and difficulty concentrating, which can affect work, relationships, and overall quality of life. Sleep apnea is another condition that occurs more frequently in people with kidney disease. Fluid shifts during sleep can narrow the airway, leading to breathing interruptions. Poor sleep further stresses the body, increasing blood pressure and worsening kidney function, creating a harmful cycle. What makes these symptoms particularly difficult to recognize as kidney-related is their commonness. Back pain, infections, feeling cold, and sleep problems are widespread in the general population. Each symptom alone seems manageable or minor, and they are often treated separately. Pain relievers may be used for back pain, antibiotics for infections, extra blankets for cold sensitivity, and sleep aids for insomnia, all without addressing the underlying cause. Over time, this fragmented approach can delay diagnosis. While symptoms are temporarily managed, kidney damage continues to progress. By the time these issues become severe or persistent enough to prompt further investigation, kidney function may already be significantly reduced. The emotional and physical toll of these combined symptoms can be substantial. Chronic pain, repeated infections, poor sleep, and constant cold sensitivity can lead to fatigue, low mood, and reduced resilience. People may feel worn down without understanding why, attributing their condition to aging or lifestyle rather than an underlying medical issue. Many people diagnosed with kidney disease later realized that these symptoms had been present for years. The unexplained back discomfort, the repeated infections that kept returning, the constant feeling of being cold, and the restless nights all seemed disconnected at the time. In hindsight, they were pieces of the same puzzle, pointing toward declining kidney health. Understanding that the kidneys influence immune function, Red blood cell production, fluid balance, and toxin removal helps connect these symptoms. When kidneys are compromised, the effects are widespread, reaching far beyond urination alone. Recognizing patterns rather than isolated symptoms is key to early detection. Paying attention to persistent back pain that does not behave like muscle pain, recurring infections, unusual sensitivity to cold, and ongoing sleep disturbances can provide valuable clues. These signs may not feel dramatic, but together they can signal that the kidneys are struggling to maintain balance. The body often sends multiple subtle signals when an essential organ is under strain. When these signals appear repeatedly or in combination, they deserve investigation. Listening to these quiet warnings can lead to earlier diagnosis, better management, and a greater chance of preserving kidney function and overall health. Early detection and timely medical attention can make a profound difference in the course of kidney disease, yet this is often the most overlooked aspect of kidney health. Because kidney disease develops slowly and quietly, many people only seek help when symptoms become severe or disruptive. By that stage, a significant amount of kidney function may already be lost. Understanding the power of early detection shifts the focus from reacting to advanced illness to preventing long-term damage and protecting overall health. The kidneys have a remarkable ability to compensate for damage. Even when a portion of kidney function is lost, the remaining healthy tissue works harder to maintain balance in the body. This compensation is what allows kidney disease to progress silently for so long. However, it also creates a false sense of security. By the time symptoms become obvious, the kidneys may already be operating at a fraction of their normal capacity. Early detection aims to catch problems before the silent compensation fails. Routine medical tests play a crucial role in early detection. Simple blood and urine tests can reveal changes in kidney function long before a person feels unwell. Elevated creatinine levels, reduced filtration rates, or the presence of protein in the urine are all early indicators that the kidneys are under stress. These changes often appear years before severe symptoms develop. When detected early, they provide an opportunity to intervene, adjust lifestyle habits, and begin treatments that can slow or even halt progression. Medical attention at an early stage allows healthcare providers to identify and manage underlying causes, such as high blood pressure or diabetes. These conditions are leading contributors to kidney disease, and controlling them effectively can significantly reduce further damage. Early treatment may involve adjusting medications, improving blood sugar control, reducing sodium intake, or addressing risk factors like smoking and obesity. These interventions are far more effective when kidney damage is mild rather than advanced. Lifestyle changes made early can have a lasting impact. Adopting a kidney-friendly diet, staying physically active, managing stress, and maintaining healthy hydration all support kidney function. When kidney disease is caught early, these changes can preserve remaining kidney capacity for many years. In contrast, when diagnosis occurs late, lifestyle changes alone may no longer be enough to prevent serious complications. Early detection also allows for careful monitoring. Regular follow-ups help track kidney function over time and catch changes before they become critical. This proactive approach enables timely adjustments to treatment plans and reduces the risk of sudden deterioration. Monitoring also helps prevent complications such as electrolyte imbalances, anemia, and bone disease, which often accompany declining kidney function. One of the greatest benefits of early medical attention is the potential to delay or avoid dialysis and transplantation. Dialysis is life-sustaining but physically demanding and life-altering. Transplantation, while often effective, involves long waiting times and lifelong medication. Slowing kidney disease progression can postpone or eliminate the need for these interventions, preserving quality of life and independence. Early detection also reduces the risk of cardiovascular complications. Kidney disease significantly increases the risk of heart disease and stroke. Managing kidney health early helps protect the heart by improving blood pressure control, reducing fluid overload, and maintaining healthier blood chemistry. This interconnected benefit highlights why kidney health should never be viewed in isolation. Psychological well-being is another important factor. A late-stage diagnosis can be overwhelming, bringing sudden lifestyle changes, complex treatments, and emotional stress. Early diagnosis allows people time to adjust, learn about their condition, and make informed decisions. It fosters a sense of control rather than crisis, reducing anxiety and improving adherence to treatment plans. Despite these benefits, many people avoid medical evaluation due to fear, cost, or the belief that symptoms are not serious enough. Others assume that feeling mostly okay means nothing is wrong. This mindset delays care and allows kidney disease to progress unchecked. Changing this perspective requires awareness that kidney disease does not always cause pain or dramatic symptoms early on. Education plays a vital role in encouraging early detection. Understanding risk factors such as family history, diabetes, high blood pressure, and age helps people recognize when screening is especially important. Awareness of subtle symptoms like fatigue, swelling, or changes in urination can prompt earlier conversations with healthcare providers. Knowledge empowers people to advocate for their own health. Healthcare systems also play a role by promoting routine screening for high-risk individuals. Regular testing for kidney function should be as routine as checking blood pressure or cholesterol in vulnerable populations. Early identification benefits not only individuals, but also healthcare systems by reducing the burden of advanced kidney disease. The idea that kidney disease is inevitable or untreatable can discourage people from seeking early care. In reality, many forms of kidney disease progress slowly and can be managed effectively with timely intervention. While some damage may not be reversible, slowing progression preserves function and improves long-term outcomes. Many people living with kidney disease look back and realize that early signs were present but ignored. The missed opportunity for early action is often a source of regret. Recognizing this pattern underscores the importance of listening to the body and taking subtle changes seriously. Early detection is not about creating fear, but about creating opportunity. It offers a chance to intervene while options are still wide, while the kidneys still have resilience, and while quality of life can be maintained. Medical attention at the right time transforms kidney disease from a silent threat into a manageable condition. Paying attention to early signs, attending regular checkups, and responding promptly to abnormal test results are acts of self-care that can have lifelong benefits. Kidney health is closely tied to overall health, and protecting it early supports the entire body. The kidneys work quietly every day to keep the body in balance. When they begin to struggle, they often signal subtly rather than loudly. Early detection and timely medical care are the keys to hearing those signals and responding before irreversible damage occurs, allowing the kidneys the best possible chance to continue supporting health and well-being for years to come.